Hi, I am Ila JC Cantoja, first year nursing student at Central Mindanao University, and today I am going to demonstrate the procedure called administering intramuscular injection. But before that, we're going to do an assessment, which is to assess the patient's knowledge of the medication, to assess the patient for any allergic reaction or allergies, check expiration date before administering the medication. For the possible nursing diagnosis, we have deficient knowledge, risk for allergy response, and for the materials needed for this procedure, we have disposable gloves, the syringe with needles. These are sterile syringe, and an alcohol prep pad, and of course the medication. Since we are all set, let us now start the procedure. Procedure number 1 is to verify the practitioner's order. Review an accurate list of all of the patient's medication and supplements and allergies. This is to ensure that the right patient receives the right medication. And for procedure number 2, you need to know the actions, adverse effects, and side effects, and nursing responsibilities related to the drug. So the patient is going to be taking a benzyl penicillin. This is also known as benzathine penicillin G. It is an antibiotic medication used for treatment of a number of bacterial infections. Specifically, it is used to treat strep throat, diphtheria, syphilis, and yaws. It is also used to prevent rheumatic fever. This is the medication. And for step number 3, you need to wash your hands or apply alcohol-based hand rub to prevent the spread of microorganisms. Step number 4 is to prepare, gather supplies, and check medications. This is to save time and to use our energy efficiently. So we've already gathered the needed materials here. So let's proceed to procedure number 5, which is to compare doctor's orders with the medication ticket and the medication ticket with the medication itself. This is to ensure that the right medication is to be used and to avoid any errors while administering. Now going to check it. This now confirm that they are all in uniform. So for procedure number 6, we need to check for the expiration date. This is for the safety of the patient. So based on what's written here, it is going to expire on 10/22, so next year, October 2022. So it is still consumable. For procedure number 7, perform the standing 3 checks of the drug together with the medication ticket. It is when it is taken from the medication cart, before withdrawing the medication, and after withdrawing the medication. This is to ensure that the right medication is to be used and to avoid errors in administering the medications. So we've already checked it a while ago before it was taken from the medication cart, and now and for later. It's not confirmed. For procedure number 8, compare the medications and calculate the dose properly. This is to avoid overdose or less dosage. So we've already calculated the dose, and now we're going to proceed with the procedure number 9, which is to transport the medication using a tray and the necessary supplies to the patient's bedside. This is to save time and to use our energy efficiently. Let's go. Hi ma'am, good day. I am JC Cantoja. I am your nurse for today. Pwede na kung pala yung pangalan ma'am?
Marlita Cantoja.
Kamusta man yung birthday?
September 28, 1963.
Nakay-allergy ma'am?
Penicillin lang man to.
Sige pa. So, this is for step number 10 and 11. You need to introduce yourself and identify the patient. This establishes rapport and the cooperation of the patient, and it reduces their anxiety and stress. So now we're going to proceed to procedure number 12, which is to explain the procedure and the actions of the drugs. So ma'am, ang i-inject sa mo for today is it prevents your rheumatic fever po. So mag-inject lang ko sa inyo din. Mananayin siya ma'am. Maano to siya ma'am. So this is to give or provide knowledge to the patient. For procedure number 13, you need to provide the client's privacy to ensure that the patient feels safe and secure. And for procedure number 14, you need to wash your hands and don gloves. So I'm going to apply alcohol-based hand rub since I already washed my hands. And I'm going to don now the gloves. And for procedure number 15, select the site. There are 3 sites like deltoid, ventrogluteal, vastus lateralis, and you need to disinfect it. Good visualization is necessary to avoid complication and establishes correct location. So now we're going to choose the deltoid, which is located here. And now we're going to, it's located here. And now we're going to proceed to procedure number 16, which is to pinch the site with the non-dominant hand. Insert the cotton between the 3rd and 4th finger. By doing so, the patient will feel the pain of the pinch rather than the needle insertion is more painful. For procedure number 17, you need to remove the needle cap with dominant hand to lessen the risk of an accidental risk. For procedure number 18, you need to quickly inject a 90 degrees angle the medication in a dart-like fashion. This is to lessen the pain and to ensure that the needles reaches the certain muscle. So now we're going to insert the cotton. Now we're going to clean. You need to start from the center, going outside. And after cleaning that, you need to get the cotton, put it in your 3rd and 4th finger, and get the syringe. By using your dominant hand, you need to remove the cap. And you need to pinch here so that the patient will not feel the pain of the needles. You need to inject it in a 90 degrees. Quickly inject at 90 degrees angle the medication in a dart-like fashion. This is to lessen the pain and to ensure that the needles reaches the certain muscle group. And for procedure number 19, using the thumb and the forefinger of the non-dominant hand, hold the barrel of the syringe, while the dominant hand will hold the plunger for aspirations. By moving the syringe, it could cause damage to muscle tissue. For procedure number 20, aspirate slowly by pulling the plunger back and watch for pink-red flash of the syringe. This is to ensure that there are no blood vessels hit by the needle. So there is no blood. We are now going to proceed to procedure number 21. If no blood is aspired, inject the medication slowly, 10 seconds per ml. This allows medication to begin to diffuse in the surrounding muscle tissue. Procedure number 22. Count 1 to 10 before withdrawing the needle to stop the blood flow and allows medication to begin to diffuse in the muscle tissue. And after that, you need to use the cotton from the non-dominant hand and to apply pressure. It ensures cleanliness and orderliness to stop the blood flow. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. For procedure number 24, do aftercare and discard the needles in a puncture-proof container. This ensures cleanliness and orderliness and to prevent contamination. And after that, put it in the container. Like this one. And now we're going to dispose this. And for the last, second to the last step, you need to remove your gloves. And apply alcohol-based hand rub for hygiene and prevent contamination. And for the last step, you need to evaluate and document the care to monitor and record the progress of the patient. So now, time. So now, we are done with the procedure. Thank you for watching.